Brachial artery.
This is one of them, and then the other half is disappearing up in that direction towards the gills.
Ventral aorta.
The ventral aorta is going to be below that branching point.
Conus arteriosus.
This larger lump here where we have a lot more branching up here, if you've noticed in the back. So this area.
Atrium.
The atrium. Here.
Ventricle.
The ventricle is this large muscular mass.
Sinus venosus.
Spinous stenosis is going to be underneath the tissue there.
Parietal pericardium.
Parietal pericardium. You can see the remains here as the shiny layer.
Visceral pericardium.
Visceral is going to be this attachment here.
Transverse septum.
Transverse septum we still have a little bit intact. It's here. It separates the cardial cavity from the peritoneal cavity.
Internal carotid artery.
Okay, so the internal carotid artery is going to be up here. So this U point here goes up into it.
Paired dorsal aorta.
Paired dorsal aorta. They are down here. So, yeah, so the paired dorsal aorta, they are these two lines dropping down into this area.
Efferent brachial arteries.
So they're the larger arteries that are leaving the gill slits here.
Dorsal aorta.
And so in the dorsal aorta is going to be where they all connect lower down in this area.
Anterior mesenteric artery.
Okay. Anterior mesenteric artery. We're going to have to go down in here. So the anterior is going to have a branch point earlier on. So it's this branch here. Okay, so this is the branch point here. It goes down and it wraps itself around and ends here.
Anterior ventrolateral artery.
So the ventrolateral artery means that it is on the ventral portion of the body and it has a lateral sides. So it has both sides. Here is the pink one.
Brachial artery and vein.
Okay, so the pink tissue here, these are the arteries, and then the deep to that you can see the vein.
Caudal artery and vein.
Okay, so down in here, so the artery is the pink one, it's coming up into here, and then the blue one is the vein you can see disappearing into the fin.
Can you do that one more time, please?
It's going to be down there. Caudal artery and vein is the one that we couldn't see. I'm just saying, so we know, like, it's where the
Okay, then we're
hemal
gonna have to
arches
edit
should be.
this.
That's okay. Just keep going. It's fine.
Okay, so
So-
the femoral arches here, so one would be for the artery, the other one would be for the vein.
Okay.
And then this is for neural tissue we haven't covered.
Okay.
Dorsal, femoral artery
Femoral artery, okay. So, sorry, this is the femoral artery,
and vein.
and the vein is seen up here going into the tissue.
Okay, that's a
of the
correction.
fin.
Okay.
Gastrosplenic artery and vein.
Okay, so gastrosplenic. Okay, so the artery here, it's in the spleen, it's in the stomach, and then if we follow it back up, it is the second branch here that comes down and stretches here.
Ovarian artery.
Wait 1 second. In the video, you can't see that it twists.
Yeah.
Yeah.
You can see it
So
now?
there's a twist here where the secondary seems to be coming first, and that the first seems to be coming second, but you have to follow because they twist up in this section here. But this is still the first one, and this is going down here.
So one more time, the two different ones are.
So this is gastrosplenic, and then the one up here that goes here, this is the
It's the anterior
Anterior.
mesenteric artery.
Okay.
Then it's the ovarian artery.
So the ovarian is going to be up inside. So so this is our ovary here, And then these are some of the arteries. I pulled one up in the way so you could see it better.
Okay.
Intersegmental arteries.
So intersegmental, they're going to be these pink lines. They're in between what would be the myomeres.
Posterior mesenteric artery.
Okay, so posterior mesenteric artery. Did we already do that one? Yeah, we
It's
already
the
did
one.
that.
No, we didn't. We
Oh,
did the
okay.
anterior mesenteric.
Sorry. Little confusion, only because there's so many here. Okay, so posterior is going here, and it ends in the digitiform gland.
Okay, where does it start?
It starts up here,
Okay.
and it branches off and becomes the artery attached to the digitiform gland.
Posterior ventrolateral artery.
Posterior ventrolateral artery. So you can see part of it down here, and then if you look on the other side, it's a much clearer view. And it becomes the anterior one as it branches in the middle of the body and gets closer.
Hepatic portal vein.
Hepatic portal vein. So it's a latex injection of yellow coloring just so we can differentiate it from other blood vessels.
Lateral abdominal vein.
That's to that blue artery right there. She's pointing to it. It's huge.
And it also
really
connects
big.
between the two cavities.
Uh-huh. And it's on the other side too.
Yep. Indeed.
Perfect. That's
Posterior cardinal vein.
Okay. So try and get in between so you can see the mesenteries better. Okay, so cardinal is just the main.
Renal portal vein.
Okay, so the shark has kidney tissue here. It's underneath the membrane, but I had to cut it away to expose it. So you can see where the vessels come, and they're going to be joining up with the posterior cardinal vein.
Renal port.
Okay.
done.